Welcome to Medical Insight, a weekly healthcare feature brought to you by the experts at Essentia Health. Here's your host, Louis St. George.
Today on Medical Insight, Dr. Ryan Greshel describes how Essentia Health is treating acid reflux with an innovative device called the LINX Reflux Management System, which strengthens the lower part of the esophagus.
The way we were intended to be is that at the end of our esophagus, before the stomach starts, there is increased tone in the muscle there. We call that the lower esophageal sphincter. So a normal person has some increased tone right there that can relax to allow food to go through it into your stomach, but when you're not swallowing, it's designed to stay tight so that acid from your stomach is not refluxing up into your esophagus. So the LINX device works by adding this ring of magnetic beads around that portion of the esophagus to provide some additional tone.
Surgery to implement a LINX device is minimally invasive and lasts between 30 and 60 minutes. Recovery is swift as patients typically go home the same day and can immediately return to their normal diets.
Who's going to pursue some surgery for their GERD or surgical correction for GERD is generally patients that have severe symptoms and they're not getting the relief from the acid suppressive medications that they would like. After placement of a LINX device, about 85% of patients will completely get off their acid suppressive medications. As far as symptom control, many patients with GERD have heartburn or regurgitation or pulmonary symptoms, but 99% of patients with a LINX have no more regurgitation. So if they had regurgitation before, it's gone. 88% of the patients with heartburn no longer have heartburn after a LINX is placed. So the symptom resolution is excellent.
For Medical Insight, I'm Louis St. George.
This Medical Insight was brought to you by Essentia Health. To learn more about the services we offer, visit essentiahealth.org.